In this podcast from Chapter 5 on moving and transporting patients, we want to take a look at packaging patients, and we want to understand the correct steps and the decisions that we make when we package a patient for transport. Let's begin. Packaging is that process where we prepare the patient for transport. We consider the injury they have and reduce the risk of any further injury. So we'll position them in the toboggan, make them comfortable, secure them, and make sure that all of the necessary medical equipment goes with them down the hill. Judgment is needed to put the patient in the toboggan. The first decision is based on what are the patient's injuries. And from that, we can decide will they be head uphill or head downhill. Now, 90% of the time, it's just going to be injury uphill. That will protect that injury while they're being transported. For a traction splint, normally we might have the lower extremity injury, if they had a fractured femur, in a head downhill position. The head uphill position would be harder to maintain traction. Gravity is working against that traction, and if they slide downhill, that traction splint is going to collide with the front of the toboggan. So this is a great example of what we saw in the last slide, injury uphill. And we see it in this picture that we see here. We have a patient with a splint on their lower right leg, and that injury is uphill. Now, if a patient has multiple injuries, prioritize more significant injury uphill. Now, with breathing difficulty, we may have to just consider the primacy of protecting the airway and breathing. And in this case, head uphill is positive for the patient because when they are head downhill, the abdominal cavity can press upward on the diaphragm at the bottom of the chest cavity and not allow a patient to breathe as deeply. They're going to rely only on accessory muscles for breathing. Another consideration would be for a serious head injury. Again, the fundamental principle of injury uphill is something we see here with a head injury, head uphill. Most of the time, it will help with securing the patient if we just put them in a supine position. Now, there are a few exceptions to this, such as an anteriorly dislocated hip, because in that case, the injured leg could be backwards. And typically, we're going to avoid the prone position because of the breathing difficulties that we might encounter. Another unique instance is for a pregnant woman. If a patient is pregnant, they can be placed on their left side because that will ensure that the contents of their thoracic and abdominal cavities, specifically the thoracic cavity, will not compress the vena cava. Similarly, we can put someone on this left lateral recumbent position, laying on their left side if the patient is unresponsive or responsive, either one, and they're vomiting. This will protect their airway because gravity will allow it to stay clear. General considerations: make the patient as comfortable as possible. In cold temperatures, your toboggan should probably include a blanket, and we want to provide that to the patient, not just for padding, but for insulation as well. And then for securing the patient, we'll use the attached straps to the toboggan, in addition to what may already secure them, for example, to a long spine board, to ensure that the transport is safe. If an extremity has been splinted, we want to make sure that that doesn't move, and so securing the patient securely in the toboggan, straps over the top can assist with ensuring that that doesn't move. Now, when we do that, make sure that we don't place that strap over the injury. In general, position the patient in the toboggan using your best judgment, typically injury uphill. Make sure that the patient is comfortable, they're padded, and they're warm. Securely fasten them in the toboggan and make sure the necessary medical equipment is transported with them.